The Care to Chat podcast offers a safe space where we can discuss important topics with experts and those with lived experience. This podcast episode contains discussions about violence against women and girls and domestic violence, and we advise listener discretion as this can be a sensitive discussion to listen to for some. We'll be listing a number of resources at the end of the episode if you or someone you know requires support. And for support, please call the Domestic and Sexual Abuse Helpline. It's open 24/7. That's on 0808 802 1414. And in an emergency, dial 999. Care to Chat? Hello and welcome again to the Northern Ireland Social Care Council's popular podcast, Care to Chat. I'm Wendy Austin, and it's been my pleasure to host these podcasts, now in their fourth series, hearing the stories of social workers, of social care practitioners, and those who are their service users, and to hear of the work itself from domiciliary care to probation, early years to end of life, and the constant improvements and adjustments as change is implemented in health and social care here. It's been a real education for me, and I hope an interesting listen and a useful tool for you. On our episodes of Care to Chat, we've tackled and discussed many difficult and serious topics, but probably none more so than this: tackling violence against women and girls. The statistics are nothing short of horrendous. In the period 22 to 23, an incident of domestic violence was reported to the police every 16 minutes. In total, 32,875 domestic abuse incidents and 22,343 domestic abuse crimes. At least 30, that's 30, women and girls have been murdered in Northern Ireland since 2020. So today we brought together experts in the field to help break down the complexities of what violence against women and girls means in Northern Ireland, in particular for the social work and social care workforce. With me, Tracy Reid, Chief Executive, the Northern Ireland Social Care Council; Sheila Simons from the Safeguarding Board for Northern Ireland; Sonya McMullan, Regional Services Manager with Women's Aid Northern Ireland; and Anne Marks, Independent Chair of Domestic Homicide Reviews. So, Tracy, maybe you could start us off here. I mean, it's an enormously important topic. Why is it an important discussion for social care and the social work workforce?
I suppose, Wendy, I have been a social worker for over 25 years now, and I have worked in a whole range of different areas. So I've worked with people who are people with older people with disabilities, people with learning disability, palliative care, families, children, and it didn't matter which part of social work that I worked in, this was a prevalent issue. And over the last number of years, more recently before I came here to the council, I had a role in the oversight board for the domestic homicide reviews. And it just always increasingly struck me, we were not doing and are not doing enough in this space. And sometimes I think you can think, well, is there somebody else going to come along and do it? But I've come to that realisation that we all have to do what we can with what we've got. As the regulator for the social care and social work workforce in Northern Ireland, we have access to some 50,000 staff. And many of them are going in and out of houses today, working with people who are experiencing sexual and domestic violence. Some of them will be victims, and unfortunately, a small number of them may be perpetrators. And so for me, it was really, really important, just working that principle. What can we do with what we've got? How do we encourage those staff who have such access across Northern Ireland to actually have those conversations, to raise their awareness? For us, it will be the start of I hope, a number of podcasts around this matter. But for us, it was really important just for us to take that position of why is this important and what do we want to say to our registrants about it?
Sheila, what does this look like, if I could put it like that? I mean, I know that there are many different kinds of violence that take place against women and girls, but how might a victim present?
I think sometimes it's very hard. Some victims will show you no signs whatsoever, and that's where you have to give people the opportunity to ask things like, is home a safe space? Are you worried about going home? how's family relationships? You have to have those conversations to enable people to give you the responses. And I think, for example, with the health visit and the midwives, they would ask a lady in her pregnancy and postnatally, are they living with domestic abuse? And most women will say no. But when they did some research into that, the women said they appreciated being asked. And when they felt ready to disclose, they would go back to that person who raised the question with them. So it's about trying to raise that, allow people to have the conversations. And I think for any professional that crosses the threshold of a household, whether you're a GP, whether you're a health visitor, whether you're a home care worker, whether you're a social worker, physio, whatever, everybody needs to have some training in and around domestic abuse and recognising symptoms and being able to ask those questions. Because if we ask those questions, we'll make the conversation a wee bit more easier. And it's enabling the professionals to feel more comfortable about asking uncomfortable questions. And I think people avoid it, rather than ask. But people do appreciate actually being asked.
Sonya, in Women's Age, you must be critically aware of all of that.
Yes, Wendy, we have almost 10,000 people presenting last year for services, and our services are constantly under demand. Many years ago, with new legislation coming into place, protection orders, things like that, we were told that we wouldn't need refuges, but we'd still need. Sadly, home is still not a safe place for so many people. And we will always need emergency accommodation, sadly, for women, children and young people to be able to go to. All the protection orders and safety measures and legal remedies that we have, for some people still, it is not safe enough and they need that place of refuge. So Women's Aid would provide refuge accommodation, that emergency accommodation, across different sites across the whole of the country, together with outreach services, because it's really important that we also support women, children and young people in their homes as well, and also court support, other preventative programmes as well. And it's really important that we are there to be able to meet people at their time when they're ready. And, Monica McMullan said many years ago, it's a process, not an event. And people sort of think, I'll ring up, I'll get support, I'll get it sorted, that'll be it. But we know it's definitely not that. And it is a real journey and it's very difficult and it takes tremendous strength for women to come forward, to disclose something that is shrouded in guilt and secrecy and shame, and to be able to come forward. So it's so important, no matter who that is, a Women's Aid worker, a police officer, social worker, nurse, that response is spot on, that they're believed, they're accepted and acknowledge what they're said. And, the response within those first few seconds and few minutes, people decide whether they're going to engage. And that could put them back, a few weeks, a few months, a few years before they come forward again. So it's really important that we're all there. And as Sheila has said, we know how to spot those signs and symptoms. We can ask those right questions and do it in such a way that we're encouraging people to come forward.
And how interesting, as you said, Sheila, that often if the person has thought about it, they go back to the person who asked.
Absolutely. I would have found, working with children all my life, it's only in recent times we're talking about more openly about more other forms of abuse. People always thought of it as physical. So 40 years when I started social work, I think we had half an hour lecture on domestic abuse. And it's really only the last 5 years with all the legislation that's come on board, people are starting to become more educated about what is coercive control, what does that actually mean to live with coercive control, understanding economic abuse, the controls there, and how many barriers there are that make it so difficult for women to come forward.
You, Anne, deal with the really bad end of this, don't you? I mean, the figures are appalling. And that homicide timeline that came from Professor Jane Monckton-Smith, I've got to say, it was absolutely chilling. Do you start there and say, we're not going to allow this to happen anymore and work your way back, or what do you do?
Well, really, when it comes to domestic homicide reviews, you're reviewing the most catastrophic of events. And it's not just reviewing what happened at the time, it's reviewing the events leading up to that death. Looking at the lived experiences of the homicide victim. And that's really where we see the rich source of information about the nature of the domestic violence and abuse, where there are weaknesses in professional practice, and how we can strengthen those systems in order to make change and prevent deaths in the future. So all of those things come together, and it is about looking at the barriers, and we've heard some of those already from Sheila and yourself, Sonya, those barriers there for women in terms of accessing support and protection and justice as well. So by doing all of those things, by talking to staff who are involved, who often have very real ideas about how things can change, about reviewing records, importantly about engaging families of loved ones, because they will come along, they can tell us who their loved one is, for starters, but importantly as well, they can share some information about their lived experiences and their thoughts. And they're really good at this, their thoughts about where professional practice can improve. And I, as a chair, find that extremely useful and taken forward, giving me some direction to follow.
It's interesting, your focus obviously here is very much on the victim. And I'm aware that in my former profession, the focus is almost always on the perpetrator. You quite often find out little or nothing about the person who has actually been murdered. That surely has to change as well.
Absolutely, and when we work, when we discuss and we debate at panels, so that's a team that I would chair of multi-agency, I suppose, senior people, we discuss and we debate that person. Not just the perpetrator, and we would invite family along to our panel meetings to meet the people who are discussing their loved one, and we often have a photograph of their loved one as well to remind us why we're there. Importantly as well, as part of the work, we have the likes of Women's Aid there who keep us very focused on the voice of the victim, which is extremely important because sometimes we can go down different rabbit holes, but they're very good about bringing us back and sharing the rich information that they have as well about their work with victims.
So how important is it that we now have the Ending Violence Against Women and Girls framework and the domestic and sexual abuse strategy in place? I mean, maybe if I put this to you, Sonya, I mean, how likely are those to help to lead to change?
Well, I suppose to set the scene in context of it all, we're the last part of the UK and this island to get an Ending Violence Against Women and Girls strategy. So for so long we never looked at anything through a gendered lens, and it was really frustrating because the law is gender neutral, of course it is, and all the statutory guidance and everything goes with it. But we needed to be able to look at those common themes that we're presenting in relation to women and girls, and we simply weren't, because I think we had a stop-start government, we had all of the issues that prioritise everything in this country. And it is shameful, it really, really is, that we let that happen for so long. So we put in a petition, and Arlene Foster and Michelle O'Neill were the Deputy and First Minister at the time, and we called for this, and the petition got to 25,000 within, a few days. It was unbelievable. And we got Jess Phillips and Stella Creasy, and we, were everyone from Westminster at the time, and they could not believe that we didn't have a strategy. So what happened was then, sadly, that was the week Sarah Everard was murdered. We also had 2 women in Newton Abbey were murdered, and it took that, for this to change minds. And it was very, very frustrating. But then we had that commitment from government to move forward. So it is a strategy. It is a shiny strategy and a piece of paper, and it doesn't solve everything. So we're into year 2 now, but we feel that it has started a process where people are talking about ending violence against women and girls. They're talking about that number of 30 women. They are talking and having those conversations, which are having ripple effects, we hope, because we need to go to the people. We can't expect people to come to us for training and awareness and all. We need to go into the grassroots in our communities if we're going to change anything. And a lot of the money and funding from the Ending Violence Against Women and Girls strategy was doing that, going into local councils, going into, I believe sport is a huge factor and a great place to start in relation to having those conversations and going to the grassroots, to young boys, young girls. But it's not just young girls and boys, it's everybody. Attitudes need to change in 40, 50, 60-year-olds, as well. But we do hope, this is something that has united the whole of our assembly together, and they are all coming forward in relation to wanting to support it. So that was good. We also have the Domestic and Sexual Abuse Strategy. It's managed by the Department of Health and Department of Justice. Little or no funds attached to that as well. And I know we started off looking at what we could do with what we have, but it's still not good enough. We need to invest, and we need to invest in our people because, ultimately that will save lives. And we won't need Anne to be doing domestic homicide reviews. We need early intervention, prevention models. And there's lots of good work out there, but we simply sometimes, are not doing enough.
And I suppose, Sonya, I'm thinking about children.
Yeah.
That for the first time, the Domestic and Sexual Violence Strategy has added a children's pillar. Children for far too long, Wendy, have not been acknowledged. They live in these situations. It's not a one size fits all. The ability to speak to children, to reach to children, and we were delighted when we pushed for Operation Encompass. That's where the police, when they do a call out, they inform the school the next day so that the teachers can be there and support the child, whether it's with a smile. And what brought that about is I remember a young girl had to go into a hostel one night and she hadn't had her school uniform the next day, so she was made an example of the next morning because she didn't have her blazer. That was never going to be the environment for that child to be able to say why I haven't got my blazer, and she was never going to share it in that big forum. So that led to bringing in Operation Encompass, and I was just checking yesterday that we've had 56,000 referrals since Operation Encompass went live, and that's in relation to children. So we need to get down and have these conversations in school about respect, about healthy relationships, be able to talk about children, because sometimes they don't recognise that they're not actually in a healthy environment.
How important is it, Tracy, that the four of you are around this table and that there are so many other organisations that are now buying into this, for the want of a better expression? Sonya says that we need to invest in our people. As far as you're concerned, that's very much your people who maybe, in a case of domestic abuse, maybe that's the only person that victim sees.
And I suppose that's the shocking aspect, because no matter where you go in the lifespan. So firstly, I've worked in adult safeguarding for many, many years. And when you're working then with older people who have been through just by the very circumstances of, I suppose, where women were in terms of often having to come out of the workplace and so forth, often quite isolated, that actually we were finding people there who had endured lifelong abuse. And a real sense of shame and guilt. And one of the things that strikes me is that this is complex. These are complex issues that we're dealing with. But I am a strong believer in the power of kindness. And so many things I've looked at, and often what you see is an absence of meaningful relationships. Those relationships that allowed a person to say, I'm afraid, and somebody listened to them. And that they trusted them and that they didn't feel judged by them. And if I were to be thinking about what do we want for our workforce, I've over the years had cases where people said to me, well, they said that this, and then they said they didn't happen to them, and then they said to the cleaner it did happen, but when the social worker spoken to them, it hadn't happened. That's coming from a place where people don't understand about how people disclose that abuse. If I could get to a position where sometimes I think we can, particularly even in older people services, my experience in that is we put an awful lot of emphasis on, does a person wish to leave the relationship or not? And in not leaving the relationship, there's a sense of judgment. That needs to stop. We need to understand more about people's needs. We need to be there. We need to listen with compassion and kindness. But we need to take the judgment and leave the judgment outside the door, because if we don't keep the judgment in the conversation, they're never coming back to us to look for help. And it's that piece where we need to make these conversations. People who experience domestic violence aren't some group of other people out there. If every 16 minutes the PSNI are being contacted, they are our family, they are our friends, they are our colleagues. And we as a society need to be able to, as people, one human being to another, to care, to ask the questions. And for me, sometimes you can make it very complicated, but actually it is that piece of making it safe for a person to disclose what is such a shocking control within their life. This is something that will have dominated their family, because domestic violence happens within homes, and it affects the children, it affects the adults, it affects everyone in that system, and often people and families work around these huge secrets. And actually, we need to own that. For me, Wendy, it is about giving people the confidence to ask the question and the confidence to listen without the judgment.
How do you do that, I wonder? I mean, Sonya, when we were chatting before we started doing this podcast, Sonya and I both said that we'd had a black eye on one occasion and that no one had ever asked what had happened. And I was shocked rigid by that. And I'm sure that you were as well. So people, they don't know what to say. They don't know how to broach the subject. They don't know... I mean, are you going to fall out with them? I mean, I don't know who wants to take this, but I'm just kind of throwing it up there. How if it's a problem that we all need to be aware of and do something about, how do we do that? What's that step?
I think that's really difficult, and it's often asked, by people. I often get calls from friends or family, friends, or, can you help this person? And as we've already said, domestic abuse doesn't discriminate. It doesn't care who you are, what job you do, or where you live. And that's the reality of it. But it's not always the black eye, it's the hidden. That, as Sheila was talking about, that coercive and controlling behaviours, very often harder to explain, harder to put in context, and more difficult then because people will think, who will believe me when I tell this story? Because very often perpetrators are very skillful at not only grooming and manipulating the people, everyone around them, So people do feel then that it's going to be very hard to open this up and to talk about that. And that's why it's really important for professionals to go with that gut feeling. I know, we talk about professional curiosity and things like that, but I've spoke to social workers. They walk into a house and they just get that feeling. There's something not right here. Go with that. Ask that question in a private space, in a safe space with that person. I worked in the helpline service for many, many years, and people would have called, women would have called and said, I don't think I've rang the right place because I haven't been hit. And then we go, okay, well, look, tell us a little bit more about what's been going on for you. And then 20 minutes in, they've been pushed down the stairs. They've, multiple times they've been in A&E, everything, but they've minimised it. And they always minimise everything. So I think whenever we were doing the review of routine inquiry, for example, in maternity services, we had a survivor. We went around and spoke to women in refuge and survivors who were out of relationships and things. And they all said they would like to have been asked at every point, because if they knew the question was coming, they would be prepared next time, and then they would be ready. And they said even whenever their children were getting immunised and, mammograms, smear tests, any of those kind of spaces, we should just be asked, as well. But it is really difficult. And a lot of the work that we are doing with nurses, for example, and doctors, social workers, all of that, it is about asking that question. And it's really important to be able to have the opportunity for training, awareness, development, role play, all of those kind of things to gain your confidence in that. Because that's a problem we also have with relationships, or RSE, relationship sexual education in schools, where our teachers aren't prepared and equipped to be able to deal with, that kind of work as well. So it's really important that we get as much awareness out there. But a lot of the work we're doing in Women's Aid at the moment is from early years right through to primary school to post-primary, but then third level education as well with our nurses, our social workers. And a lot of it is how victim survivors would present as well, because sometimes they present as very angry people. They're not all sitting in a corner going, oh, poor me, that kind of, because they're defensive and because they're frightened, because they're fearful of what's going to happen and the repercussions of maybe losing their children and all of these things of opening this can of worms now and what is going to happen to me. And the reality is that sometimes that does happen. But we need for people to see the engagement of social services as a supportive environment as well, and one that can help them too. But that's all about education and learning. So it's really important that, as we've already talked about, like Women's Aid on our own can't solve this problem. We need to work in partnership with everybody.
I know when you said there, you ask the question and they say no inevitably. Sometimes I've said, I'm worried about you. You've got the right space and the quiet. You can actually say, I'm concerned that this isn't a safe space for you. Do you know, and if you want to meet tomorrow, or want to come the next time, and even I pass notes to people to meet me in a different building, because sometimes they're upstairs listening, you know, and they're very conscious of what the repercussions are going to be if they've said anything to you when they leave, because they have to live with it, whereas I can walk away and I can go home.
And what about coercive control, Sheila? I mean, that's much more subtle, perhaps, isn't it?
Absolutely. I think Professor Stark, who wrote about it, basically, I think he summed it up very well, and it said, instilling in the mind of the victim the price of their resistance. And that says so much. They know exactly what's going to happen. It can just be a look. And that's, you can pick up on that. It's watching the body language, listening to that interaction. But it comes out in so many different ways. I mean, people will bug your car, track your car, measure what petrol, where you've been, look at the mileage. And they just chip it away, that your actually whole self-esteem falls away. And you actually think, nobody is going to believe me, I'm worthless, you know.
And I do think as well, I think a lot of people seem to think that, you know, I would know if he was an abuser. I would have picked that up. He couldn't be. People who are abusive are actually quite skilled at being abusive, and they go to great efforts to groom and maybe move themselves into positions of power. And part of that chip is that sense of worthlessness. Who would believe you? And I have the power, and I am out there grooming other people, so you're never going to be believed. And so when somebody's at a level of power over you, because they do, and they control you every day, then it's very hard to have faith that anybody's going to believe you. And that's the power of that. And I suppose, you know, some of the things that strike me, particularly within social work, we have, and one of the things I was keen for us to start to look at this, because social work works at various stages of this whole. So we work with children who are living in these circumstances. We work with adults, but we also work with perpetrators. And you know, I know many of our staff within probation do a great deal of work. And I think there's so much more opportunities to learn about how to assess that those people who are that way in terms of carrying out the abuse and perpetrating abuse. I think there's so much opportunity for us to learn from each other, because if you're in the work here, you may not see that aspect of it, and you may not work with, say, perpetrators or so forth. But it's really important that actually that staff aren't themselves groomed in that space, because many of these abusers are very plausible and powerful individuals.
And what lessons are being learned from the domestic homicide reviews? I mean, you spoke very, very clearly there about the way that you look at the victims and find out about them and so on, and maybe what has gone wrong at different stages. What lessons have been learned?
Well, we're talking about coercive and controlling behaviour, and Tracy talked about the manipulation of staff who work with abusers. And may not know they're working with abusers, because they will use those same skills that they use on their victim, on their family. They will use those on staff and professionals to influence decisions. So just as one example, you know, the probation board has just rolled out some training for staff about how perpetrators manipulate them, so which is really good. But the domestic homicide reviews really have been a driving force behind a lot of change that's ongoing at the moment. So, for example, the multi-agency risk assessment conferences in terms of how risk is assessed and managed for those deemed the highest risk in terms of domestic abuse, and there's real change that's undergoing at the moment. As well, another example would be the Domestic Violence and Abuse Disclosure Scheme, where because of domestic homicide reviews and the learning there, the threshold has been dropped, so that police will be sharing more information to a victim or potential victim about the past history of the person they're now in a relationship with. And as well as that, lots of training, coercive controlling behaviour, the dangers of non-fatal strangulation, you know, and we've seen legislation change in that as well. So there's a lot of work arising from domestic homicide reviews. And from my own experience, I would say in every domestic homicide review so far, and there has been around 30 that have been commissioned, you know, every one has something new that we're learning from that. Yeah.
Sheila, what do we know about what works to prevent violence against women and girls? Are there practical tools for the social workers and social care workers that are connected with the Social Care Council, for instance, that they can put into play to help them see through people who are pulling the wool over their eyes? Sorry.
I think training's probably the key thing there. And I know in the SBNI they created a framework looking at, everybody in terms of, level 1 training. Everybody needs to have that general awareness. Reception staff and a GP practice, what they say, you could be sitting in an A&E and you're saying something. It's giving people, helping them recognise that as part of the training, but also what to do with that. And, even the helpline there I thought was very good for professionals. It's not just for victims to make calls. It can be professional to say, and it could be even for a victim, but they don't have to give their name. It's giving people, other resources, if you like, actually maybe accompanying them to come to see Women's Aid, to give them the opportunity to be able to talk what they're going through. But there are assessment tools there. But again, everybody needs to be trained in those tools, Wendy. There's a danger if you pick up a tool, you read something, you go and try and put it into practice, it actually could be creating more of danger. So I would advocate, the training on the various aspects of domestic abuse to fully understand the holistic picture.
I suppose, Tracy, it's one of the things that I've found fascinating about social care and social work and the way that there's a kind of continuing training and so on. But it's also this business of having a professional curiosity, which is enormously important. Mm-hmm. And that sounds great, I suppose, until you're in somebody else's house and they're telling you that everything's fine. And you don't feel that you have the tools to do something about it. But I mean, is there training taking place at the moment on those specific points?
I think one of the challenges is that often when social workers go through front doors, and perhaps they're on their own, they feel the fear in the house, and the challenge for them is, if I don't feel safe to call this out, I don't actually feel safe to ask this question. Because you don't doesn't mean you can't go back, and you can't, and that is the supervision and the importance of supervision. And as Sonya said earlier, those gut instincts. If you can't lift it because you're there at that moment in time and just do not feel able to do so, then go and talk to your supervisor and make sure that you tell them and to think of a strategy, because there is a very good chance you will be back in that house. So it's being prepared for that strategy, as opposed to just thinking, oh, this feels a bit too scary to address, and then walking away uncertain but not quite sure what to put your finger on. We do have lots of training across various organisations, which particularly social work, but I would like opportunities for more for our social care staff. Our social care staff are 42,000 staff, and we have been looking at the SIP framework, which is the care and practice framework I know we've been talked about here before, and how we develop that social care workforce. And that is something we are considering at the moment. How do we do that better? And how does the system do that better? How does this become part of I suppose, what we do when we train people who are social care staff? When you go into a house and you're sharing that most intimate care with people, chances are you might be the person that actually sees the bruises. Chances are, people are delivering the most intimate care, and you're often the person that they trust. And it is important that people do call it. Now, I would have to give great credit to many of our social care staff, and I know that from having worked in adult safeguarding, do come forward. But it's that confidence of consistently people knowing what to do. And these are conversations, and that's why we wanted to have this podcast, to start that conversation, particularly as in our social care staff, to think about what can we do in this space and what conversations can we further have and what kind of training do we need to do. And we do have some resources within our learning zone on this, and we will build more resources there. And I suppose we like to make links to other resources that already exist. But I think there's an opportunity with our social care workforce, and I think that is something that we will be advocating for there to be more of.
They're a great resource, actually, aren't they, from that point of view? But sorry, Anne.
No, I was just going to say, following on from what Tracy has said, social care is so entwined in families' lives, in individual lives. And I suppose, for me, and I see it across the reviews of deaths, is there's a bit of fragmentation. So if you have a concern, I would encourage you to have that decision, your next step, actually think about it and actually speak to other disciplines that you work with who are providing services to that family, because that will inform your next steps, your next decision. Because you can nearly put your bottom dollar on it that another person in another discipline, whether it's emergency department, older people's services, children's services, will have a piece of that jigsaw too, and you get the bigger picture then.
Very interesting. I mean, it is vital, I think, Sonya, that the silos disappear in this if it's going to work. I mean, it does need everybody to be involved, doesn't it?
Yeah, we need key partnership work and all the stakeholders to be around the table. I think that's what both of those strategies are trying to do by bringing both the voluntary and statutory sector together and to work in partnership. Nobody owns this and nobody can solve it alone, so it's really important that we all build those relationships with each other.
So just to kind of wrap this up, I'd like one thing from each of you, if I could, that you'd like people to take away from today's conversation, whether access training, be more active, not passive, be aware of legislation, which I must say I think most ordinary people aren't. Elevate the voice of children, understand that they are victims too. So what, Sonya, would you most like people to take away from this?
I think for me it's everybody can do something. We all can do something, and it's wonderful. Some of the work that I've done is a programme with the IFA, and it's for young boys. And we go into football clubs, usually about 20 to 25 young boys, 16, 17-year-olds. And there's 6 weeks of healthy relationships, looking at not toxic masculinity, but positive masculinity. We're not going in talking at them, we're talking with them, bringing them on this journey, to explore the issues of violence against women and girls. And it just shows by going into young people at the grassroots the importance of it. And my first 6 weeks that I did with Rosario Local Club, I'm welfare officer there too, and I came out and I was just so positive, and I thought, if these are the young boys of the future, well, here we're okay. Yeah. So my final word.
Yeah. Tracy, what would you like people to take away from this today?
Well, similar to, I suppose, Sonya saying, everyone can do something, and if it doesn't feel right, and there is that sense of, I'm not comfortable in this situation, I know this person has changed, they're withdrawn, I see their behaviours change when someone else walks into the room, I can see the fear in their eyes. I always felt in social work, as a social worker, if you could convey in a moment that you cared and they mattered, most conversations were possible. And I think when you're in that caring relationship, you can show that you care and you create the circumstances. It's scary for people to disclose, because once you let it out of the box, you don't know where it takes you, and you don't know what your options are, and you don't have the information. But there is plenty of resource out there and people who can help with that piece. But actually, if you can show that you care and they matter, you can open a conversation.
Anne?
Well, I would encourage everybody to think who else is at risk, not only the victim in front of you, but actually to think wider than that. So children, dependent adults living in the home, and also consider the fact that somebody who is violent and abusive within an intimate partner relationship is likely to be abusive within a wider family. So, for example, 1/5 of our homicide reviews, the homicide victim is a parent killed by their adult child. So it's not just about intimate partners, it's that wider piece as well.
And Sheila?
I suppose that reinforces a bit for me, and there again, about children. We need to have these conversations much, much younger about healthy relationship, normal conversations, instead of not having a conversation at all. And one of the priorities for the SBNI is to elevate the voice of the children, and that's been a priority for a number of years now, and they're definitely trying to drive that forward, because I think prior to 5 years before they became under the strategy, they just weren't seen as victims. They were the smallest invisible victims, and we need to give them a voice, and we need to prevent them possibly becoming perpetrators in the future because of the learned behaviour.
I know I said that was kind of to wrap it up, but I was telling a fib. I suppose what we really need to get across as well is, where do you get the information? Some people are incredibly well informed, and some people just have no idea where to actually start from. So, if you want to know more about how you might be able to do your bit in this, maybe to get some training or access to public services or whatever, whether it's for your workforce or for the general public, actually, where do you go for the information?
There are a range of organisations that provide support and fantastic information. And two of them are at the table here today with our Safeguarding Board and Women's Aid. We will have resource on our Learning Zone, and we will make those links on our Learning Zone to support the podcast. So if you go onto the Social Care Learning Zone, we will have the links to those areas in which you can get that information.
Well, that's great. And actually there's also lots of other really helpful, useful stuff on there as well, whatever role you happen to play. Thank you all very much indeed for joining me today. Thanks to Tracy, to Sheila, Sonya and Anne. It's a very serious subject, one that I'm sure we'll be returning to, and I think that we've given it... I think that we've started this off in a very positive way, so thank you for your time. You've been listening to Care to Chat podcast for the Northern Ireland Social Care Council. If you want to make sure you don't miss any of them, do please subscribe. It doesn't cost you anything. Give us a rating and a review, and most importantly, tell all your friends and colleagues. Thank you.